St. Martha's, the rich heritage hospital in Bangalore, now offers the state-of-the-art cardiac care center for all its patients. It's managed by the renowned cardiologist Dr. Rangnath Nayak and team.
St. Martha's Cardiac Care Center, which is a newborn facility, but backed up by an experienced group of cardiologists and one of the best possible nursing teams, which has got a century-old tradition behind it, brings you the best in cardiac care. We have tried to develop an institution which is very comprehensive, which will give you the best form of state-of-art cardiac therapy, which is based on science and compassion.
Department of Cardiology at St. Martha's Hospital delivers comprehensive cardiac care facility including non-invasive lab and invasive cath lab.
If you look at the size of this cath lab, I have worked in various hospitals, I'll not name them. This is one of the bigger cath labs that you will find in terms of space and size. So all sorts of complex procedures involving the heart, the peripheral vessels, which is the limbs. You can even do neuro interventions involving the blood vessels of the brain and blood vessels supplying the brain. You can do pediatric interventions. Colloquially people might have heard of holes in the heart. Those can be closed.
We routinely perform coronary angiograms and angioplasties. And we do also perform emergency coronary angioplasty, that is primary angioplasty in patients who present with acute heart attack. And also we perform complex coronary angioplasties like rotablations, left main stenting, and procedures involving special imaging techniques like OCTs, IVUS, etc. And other structural interventions also performed like pacemakers and devices like ASD and PDA device closures and cardiac resynchronization therapy.
So that the patients get the best of care at the best of cost. And of course it's backed with fantastic nursing, which St. Martha's is always famous for. And along with that, excellent facilities, infrastructural facilities have been added, diagnostic facilities, great treadmill tests, echocardiography, which are two very, very important non-invasive investigations to help, and very good screening tests for detection of heart disease. And of course, it has been backed up by a cath lab, which is the state of the art, which has got all the facilities to help detect heart disease of any form, whether it is blockages in the heart disease in children, in the peripheral heart, what is called peripheral vascular disease, structural heart disease, and give appropriate treatment backed by an excellent cardiac team which knows what is best for each patient, at the same time keeping the overall patient and the family and the environment of the family in mind, and so that they get the best outcomes for themselves in the short and long run.
In CCU we have 14 beds and all the beds are equipped with all monitors, suction, oxygen, all these things, and we do treat the patients in CCU, all the cardiac cases, MI, pulmonary edema, CCF, so on.
Everything will be given based on the patient is the center point of our care. The patient will be taken into consideration for anything that has to be done to these patients to ensure the best outcomes for our patients in the short term and on long term. It's just not procedure related, but it's also related to very important part of our goal is for prevention, because cardiac is better to prevent cardiac disease than to have cardiac disease and then try to treat it.
People with risk factors, diabetes, hypertension, obesity, smoking, family history of heart disease, and if they are above 40 years of age, they should undergo preventive evaluation, see a cardiologist, get their heart evaluated to pick up disease early when it is totally correctable and curable, rather than when it is a little too late and where you can only treat and support the heart and not really cure the disease.
So we will try our best for preventive care. Hence for this World Heart Day, we have launched a campaign to have people screened for cardiac disease and give them appropriate treatment as it's required.
Free registration, cardiologist consultation, GRBs, cardiac package tests, all at 60% concession. Lipid profile, hemoglobin, creatinine, ECG, echocardiogram.
I would say as cardiologists, the World Heart Day is important. Every Indian should take cognizance of this day, because we are at the top of the pyramid of heart disease, and that's something that we cannot be very proud of.
We'll ensure that you get the best treatment to you and your families in these difficult times of COVID, which has already made healthcare a major problem in the last 1.5 years.
As part of St. Martha's Hospital's continuing commitment to provide affordable healthcare, we have established a state-of-the-art coronary care center here within this campus. To ensure that the maximum number of patients benefit from this, we have decided during this period of the World Heart Day to provide subsidized services and various packages to help cover all those people who are likely to need cardiac and coronary attention.
So which is why on this World Heart Day, we here at St. Martha's Hospital are providing such kind of an opportunity to the population around at very affordable prices. This is preventive cardiac health checkup, and we hope that people would make use of it, and this will benefit everyone around, whoever utilizes it.
On all cardiac tests, we offer 60% concession.
Don't miss this opportunity from 29th September till 6th October.
And see that to try and prevent heart disease, because prevention is much cheaper than trying to cure the heart disease once it's already established. So please join us and make the world a better place for all of you to live in, and a healthier place.
We here at St. Martha's Cardiac Care Center care for your heart. So please, on this 29th of September, the World Heart Day, utilize this opportunity and take care of your heart.
Come, partake in it. Be healthy. We care for you. We care for your hearts.
For enquiries and appointments, please contact Medical Records Officer and Public Relations Officer at 080-40128 and 287 and 080-40128-217.